That's right. Tom began his career in 1980 with John Hancock Financial Services. From 1984 to 2016, he was financial advisor, specializing in employee benefits. He then created the Turning 65 workshop, which we are going to listen to today, to provide much needed Medicare and Social Security learning programs for the workplace, including advanced training for HR and benefit teams. He attended the University of New Hampshire and has earned the Chartered Life Underwriter designation from American College of Financial Services in Bryn Mawr, Pennsylvania. And for many years, he's been a professional continuing education provider, working with numerous insurance organizations, the American Bankers Association, and human services resources professionals through SHRM and HRCI. He's been quoted in various top employee benefit topics, from Kiplinger's and Fortune magazines to the Boston Globe. And he's also more recently done radio programs and podcasts, as we've all turned to podcasts these days. And Tom has spoken to audiences from Los Angeles to Miami to Caribou, Maine. So we're really excited to have Tom here. I think he's really involved in the trade associations, including Association of Insurance and Financial Advisors, American Association for Long-Term Care Insurance, Maine Estate Planning Council, and his local Chamber of Commerce and Society for Human Resource Management. So we're really grateful to have this knowledge, the power of knowledge behind you, Thomas, to really share on this issue and to better inform our small businesses in the area. So thank you and welcome.
Great, thanks, Claudia. I appreciate that. The content that I'm going to be covering is going to take about an hour. So we're going to dive right in. We have only 2 live participants, Jennifer and Ilan. And so if you guys do have questions, you can ask them, but be judicious in your asking, just so that we can make sure we get through everything. I will take questions at the end. And so you can roll out all your questions then if needed. I'm going to go into screen sharing mode here and let's see, Claudia, you need to enable the screen sharing.
There you go. I made you host.
There we go. Okay, perfect. All right, I'm the host. So I'm going to share and bring up my screen and make it like that. Get it full size. And I'm going to get myself up out of the way here as much as possible. And here we go. This is healthcare for the aging workforce. When Medicare meets group coverage at age 65 is what we're going to be talking about. I'm going to move my little cursor over here. There is a packet of handout pages that you have. It's in the chat section for our live participants, and those who view the archive version will be able to access it. Claudia, I believe, will be able to get you that, or you'll get it one way or the other. There is a disclaimer that this is not personal, should not be construed as personal consultative advice, but rather general information. And here we go. These are the 5 areas that I'm going to cover. We're going to get started with just an overview of the basics of Medicare coverage. A very basic overview, and then we're going to move into the very important area of how small business, employees of small businesses have different coverage options and enrollment options than do employees of larger organizations. Then we'll look at the pathways that employees can travel as they transition from group to Medicare. Then we're going to look at the Medicare enrollment process itself, which you would think would be very easy to sign up for Medicare, but it's not that at all. So you need to know what you're doing and how to do it. And then lastly, there are some areas of caution, including the high income surcharge, how Medicare impacts health savings accounts, how it impacts COBRA, and a few important exclusions under Medicare. So that's what we're going to do. All right, let's get started with the basics. First thing to know, very importantly, is Medicare is actually the health insurance part of Social Security. It is not an autonomous, independent, freestanding program. It's the health insurance that you get with Social Security. It's bolted right onto Social Security. In fact, it's Title 18 of the Social Security Act. So that interplay between Social Security and Medicare is very important. You know, you'll see oftentimes when you're looking for things related to Social Security, contact your local looking for things related to Medicare, that you're directed to call the local Social Security office. Why wouldn't you call the local Medicare office? Well, there is no local Medicare office. Medicare is part and parcel of Social Security, which comes as a surprise to many people, but that's what it is. Also, please be sure that you don't confuse Medicare with Medicaid. Medicaid is the federal low-income health insurance program. It's jointly administered. It's jointly funded, rather, by federal and state money. It's administered at the state level. In Massachusetts, you have Mass Health. I'm up in Portland, Maine. We have MaineCare. Each state administers its own Medicaid program. Ironically, Medicaid, the low-income program, includes a benefit for skilled nursing home care, which is largely not covered by Medicare, which you would think would be the source of coverage for that because it's coverage for Americans over the age of 65. It also, by the way, covers about 8 million disabled Americans who are under the age of 65. But for our purposes today, we're going to be focusing on the age 65 component. And we'll talk about long-term care at the very end. It's one of those exclusions that I'll be mentioning. It is also, when we talk about Medicare, Medicaid, it's important to note that there's a sizable portion of the elderly who are low income. And as a result, they are called dual eligibles and are covered both by Medicare and Medicaid. So they get coverage for Medicare because of their age and Medicaid because of their income and financial status. So they're referred to as dual eligibles. But I always want to make sure we understand the term Medicare is not the same as Medicaid. This is a very important slide, and I hope that you can somehow burn it into your retinas, because this is Medicare at a glimpse or a glance. This really encompasses the structure of the Medicare program. Medicare is available in two forms, in two arrangements, as it were. And everybody on Medicare, once they're fully on Medicare, they choose one or the other. It is, in essence, a dual option health plan. You can choose original Medicare, where your benefits are administered by the federal government, or you can choose, and I don't say that pejoratively, by the way, that's just a statement of fact, or you can choose Medicare Advantage, a private health plan that contracts with Medicare to provide services to Medicare members. So everybody on Medicare makes this fundamental choice, either original or Advantage. And at its simplest, core, fundamental structure, this is Medicare, dual option, original or Advantage. Everything about Medicare flows from this. And the number of people who don't fully grasp this is very high. And it causes tremendous confusion, because if you're being bombarded with messaging about Medicare Advantage and all the wonderful benefits of Medicare Advantage, but you're on original Medicare, it's a disconnect. It doesn't apply to you, or vice versa. So we're going to talk about how these programs are structured and give you a solid working knowledge of this dual option arrangement. Most of the messaging around Medicare focuses on the PATs, as we say in New England. You PAT, you get your PAT A and your PAT B, your C and your D. I just always have to say that once every presentation. I'm sorry, it's my main accent. I hope you appreciated it. But Part A, hospital-related benefits. Part B, physician and outpatient-related benefits, were the original parts of Medicare. And in about 32 years on, 1997, Part C was added, Medicare Advantage, followed in 2006 by Part D, which added outpatient prescription drugs. But those are the parts. They're not the thing. The thing is those two dual options that I just described. And the parts are assembled within those options, as you see here on this slide. Hospital-related benefits, physician-related benefits. If you're under original Medicare, that's your basic package right there. And most people on original Medicare will supplement the Part A and Part B with a Medigap policy. If you have a lengthy hospital stay or a very involved illness that involves a lot of physician and outpatient charges, you can end up paying a very, very substantial amount in deductibles, co-payments, co-insurance. And so these supplemental Medigap policies are designed to fill in those potential out-of-pocket expenses. And then people on original Medicare will also purchase a standalone prescription drug benefit or drug plan for their out-of-pocket prescription drug costs. Now, people on Medicare Advantage, this Part C, which ironically, one of the parts is also one of the options, by the way, they typically have those benefits all bundled together in one program. So they get their hospital-related benefits, their physician-related benefits, their drug benefits, and usually extras like dental, vision, audiology screening. It all depends on the particular plan. Those will all be bundled together in one program, the one ID card, if you will, for a Medicare Advantage plan. So that's how those parts are assembled within those options. Everybody on Medicare, once they start in with Medicare, they will get each year in the fall the annual Medicare and You booklet. It's the biggest book you get in the mail, the biggest catalog. We don't get the Sears or the JCPenney catalogs anymore, so you get this instead. And Medicare in its own way is telling you this right there on page 6 in the 2020 version. There's several pages of, contents and privacy notices and disclaimers and so forth. But the very first thing right out of the gate that they're going to tell you is what I just told you, that there are two main ways that you get your Medicare, Original or Advantage. The problem is very few people read Medicare and You, and if they do, they're probably just going to skim right past page 6. It doesn't really jump out and pop. It needs to be spruced up a little bit to get people's attention. But Medicare is trying to tell you this as well. You choose your Medicare in one of two forms, Original or Advantage. A lot of people think Medicare is free. Well, that's not true. Part A, the hospital-related coverage, is free. You don't pay for Part A. Some people do, but it's very rare. Most people do not pay for Part A. They've paid for it through FICA, through all those FICA contributions. And when they finally go on Part A, that is fully paid. They do not have to contribute any further to Part A while they're receiving those benefits. Part B, however, does require a premium. Medicare each year establishes the total per member per month premium for Part B, and Medicare members are responsible for 25% of that premium. FICA contributions cover the other 75%. In 2020, that amount the amount members pay is $144.60 a month. Now, people who are high income, over $85,000 if they file a single tax return, or over $170,000 if they file a joint tax return, if they're married filing jointly, they pay a higher percentage of the Part B premium, go all the way up to 85%. And I'll talk about that at the very end under some of those cautions about Medicare. And of course, there's the Part C and the Part D. I just want to take a moment to talk about those, along with those Medigap supplemental policies that go with original Medicare. Part C, these Medicare Advantage plans are private health plans. They contract. There's a very extensive and very exacting credentialing process that they have to go through in order to be able to offer these plans to the public. But they are private health plans that have been approved and contracted with Medicare. 99% are managed care, HMOs, PPOs, point of service plans. And there are about 1%, about 100,000 of these nationally that are known as private fee-for-service plans, mostly in rural areas where there just isn't the population to support network plans and so forth. These allow you to select any physician who's willing to accept the terms of your plan. You would have coverage, but those are very rare. Most of these plans are HMOs, PPOs, point of service plans. Most of them will build in the drug coverage, so it's included in that bundle. And then they will include extras like basic dental and vision screening, health club memberships, etc. In order to be on a Medicare Advantage plan, you have to enroll in Parts A and B of Medicare. So you have to take the free Part A, you have to pay for the Part B, $144.60 a month this year. You have to be signed up and enrolled in those parts of Medicare in order to then activate a Part C Medicare Advantage plan. Right now in the United States, about a third of all people on Medicare are on Medicare Advantage plans, and that percentage is growing pretty rapidly. They do a lot of advertising, and original versus advantage, one is not better than the other, but over time, more and more people tend to be migrating towards Medicare Advantage. And a big part of their popularity centers around these what are called zero premium plans. About half of all people on Medicare Advantage have zero premium plans. And what that means is they just pay the Part B premium. That's it. They pay that $144.60 a month or more if they're high income, and that's it. They do not pay an additional upcharge premium to the Medicare Advantage plan. But these zero premium plans are the economy plans. They are the low cost plans, and as a result, they have higher deductibles and copays. They have the least amount of extra benefits. So people who choose these plans and have a serious health problem would be paying more out of pocket. But that's what you will also often hear about. Get a Medicare Advantage plan with a zero premium. That's what they're talking about. Under the drug coverage, when you're under an original Medicare arrangement, you purchase that as a standalone separate policy. If you're on Medicare Advantage, typically, there are some exceptions, but typically that's bundled in and included in your plan. These plans have come a long way in terms of their design and a lot of the administrative enrollment aspects from when they were first introduced. And anybody who's looking to learn about these in detail can go to medicare.gov. There's an interesting drug plan comparison tool, allows you to enter your zip code and the exact drugs that you take, and it will show you the plans that are available to you and rank them by cost, overall cost, both the premium that you would pay for the coverage if you're on an original plan and you're paying for that separately, and the anticipated out-of-pocket cost, the deductibles and co-pays for the specific drugs that you take. And you can actually get a printout. It'll show you, it'll rank all of those plans that are available. The average cost for people on original Medicare who purchase these plans separately or who are on Medicare Advantage plans and also have to purchase them separately runs about $33 a month nationally. Can be as low as $15 a month in some places, as high as $100 a month, but the average tends to be around $33. Important to note that Part D drug plans under Medicare do not have any overall annual maximum limit to claims costs. So someone who is on a Medicare Advantage drug plan, whether they are doing it under an original Medicare arrangement where they've got a standalone plan or whether it's bundled into a Medicare Advantage plan, these claims are calculated separately apart from their other claims, unlike a group health plan where your prescription drug costs are folded into your overall claims. These are calculated separately, and they share the same prescription drug coverage structure, the claim structure, the benefit structure. There's an upfront deductible, then they go into co-insurance, 75%, 25%. And then once you get through a certain level of that, then you move into the catastrophic coverage where the coverage pays 95%, but you still pay 5%. And for people who have very, very high prescription drug costs, I'm talking thousands of dollars a month, they're potentially liable all the way through for 5% of that throughout the year, in addition to the deductible and the 25% that they've had to pay. So I've seen people who their out-of-pocket costs are quite staggering, even though they have drug coverage under the Part D. And if one of your employees or family members in that situation where they have very, very high prescription drug costs, they need to look closely at how that plays out under a Part D Medicare drug plan. Word about these Medigap supplemental policies. They've been well described as the glue that holds original Medicare together. Interestingly, although the federal government sets some baseline parameters to these policies, they differ from state to state. Each state regulates these policies in its own unique way, again, subject to baselines established by the federal government. These are optional private insurance policies. You don't have to buy them. And they cover many Part A and B deductibles and copays. And as I said earlier, someone who ends up with a lengthy hospital stay, I've seen some of these people with COVID and they're in the hospital for 5 months. You know, the out-of-pocket costs of that would be astronomical under Medicare Part A. Part B, if you have heavily involved outpatient expenses and so forth, you are responsible for 20% of all of your Part B expenses with no cap, no limit. And these supplemental policies will step in and cover a lot of that, if not all of that. Each state has its own kind of structure. Massachusetts operates a somewhat unique plan. Massachusetts, Minnesota, and Wisconsin kind of do their own thing. The 47 other states have a little different take on it. But the bottom line is there are identical policy designs, and each state puts forth consumer information that'll help you evaluate the coverage in that state. And you can see here, this is from Massachusetts Department of Insurance. And you can see there are these 3 different plans. The core plan is very limited. Most people do the supplemental 1 or the supplemental 1A, and they're largely the same. And then you see on the other page, it'll actually show you the costs for these programs from the handful of companies that sell them in Massachusetts. And I apologize, I think there are more companies than I'm showing there, but I just pulled page 1 off of the rate comparison. So, but you just go to Massachusetts Medigap Guide on Google, and you will ignore the first half dozen ads that'll pop up, you know, in your Google search. But once you see Department of Insurance, it'll take you right to these pages, and you can access them there. So how do you put all this together? How does the typical person who's looking at getting Medicare coverage evaluate all of this? Well, there are 4 criteria, which really mirror in many ways the criteria that any health insurance evaluation would use. The first one is, what about access to providers? A big appeal of Original Medicare is you can go to any provider in the United States who accepts Medicare, which almost all of them do. So any physician, any hospital that accepts Medicare, you can go. It's open access. It's not managed care, whereas Medicare Advantage plans are utilizing almost 99% of them are utilizing managed care programs where you are restricted to using the providers within that network. When it comes to cost, however, Medicare Advantage plans offer that very attractive 0 premium option where you just pay the Part B premium, and then half the people just do that. The other half will pay an additional premium to get better coverage. I like to say they'll pay an upcharge to get lower deductibles, more generous extra benefits, and so forth. The problem with Original Medicare from a cost standpoint is you have to pay the Part B premium. You also have to pay for that drug coverage, which nationally averages about $33 a month. But then you have to pay for that Medigap policy. And if you look on the prior page, you can see those run a couple $100s a month. If it's someone and their spouse, you total all those together times 2, it starts to get up there for many people. Not all, but for many people, that's going to be a consideration during their retirement years. So the low cost is a big appeal of Medicare Advantage. But if you get very sick and have large claims costs, that Medigap policy that you're paying a couple $100 a month for is going to cover a lot of your out-of-pocket. And you're going to be left with very little out-of-pocket. So you can go to whatever provider you want, and much of your bill is going to be covered. As opposed to with Medicare Advantage, you could incur copays, deductibles, other out-of-pocket costs that on those economy plans, those 0 premium plans, don't get capped. There's no cap until you're up over $7,000 of total out-of-pocket expenses. So that would be something that would tend to favor Original Medicare. And then lastly, those extras, the dental and vision screenings, audiology screenings, the extra benefits vary from state to state in terms of what's mandated, but there are those very appealing extras that are typically included with Medicare Advantage, which you don't have with Original Medicare. So, and you could almost summarize it to say you pay more to get more, and you have that option with Original, but you have a more affordable premium and still get very very adequate coverage, and with some of those nice extras included with Medicare Advantage. But again, one is not better than the other. It's just a choice that everybody on Medicare has to make. We are, in case you haven't noticed, we're now starting the annual fall Medicare advertising blitz. Medicare's annual enrollment period, which allows people on Medicare to switch between options, starts October 15th. It starts next week, and it runs through December 7th each year. About 90% of the advertising that you're going to see is for Medicare Advantage plans. The federal government doesn't promote or market original Medicare. The only real promotion that you see of original Medicare is from those private insurance companies that sell the supplemental Medigap policies. And you have to decode all of this. If you see things like zero premium or get extra dental and vision benefits, well, you know it's talking about Medicare Advantage. It's often not clear. If you see the word Advantage, that gives you a tip right there. Original Medicare, typically you'll hear words like fills the gaps with original Medicare, things like that. But the problem is people get all of this messaging. It begins when they turn 64 and they start getting happy birthday cards from Medicare Advantage plans telling them they have to sign up in 12 months, which isn't true, as we're going to find out. You don't have to sign up, but you need to be able to sort through all of the messaging in order to really evaluate and understand what your options are. So I could editorialize about that, but I won't. All right, let's talk about the small business rules that affect the difference between how employees of small businesses enroll in and the options that they have with Medicare versus employees of larger organizations. And this is all driven by what's called Medicare secondary payer rules. Medicare secondary payer rules determine Medicare's claims paying position when it's coordinating with another health insurance plan. And actually, it can be things like workers' comp, liability insurance, auto insurance claims, all of that. But most commonly, it's group health coverage. And Medicare takes a secondary role in most cases, and the other insurance is primary. That's why we have the term Medicare secondary payer. And it will determine where Medicare, the position for them paying a claim when there's, Medicare plus another health insurance source involved. But there's a spillover effect that's the one that we're really concerned about, and that is an employer's Medicare secondary payer, the MSP shorthand. The employer's status, their MSP status, will determine not just claims coordination, but more importantly, it's going to determine the enrollment options for its Medicare-eligible employees. And I'm going to explain what all this confusing stuff is about here. So when an employer has 20 or more employees, and they have employees who become eligible for Medicare due to age, the threshold is actually 100 if we're talking about Medicare due to disability, but we're going to talk about Medicare due to age, turning 65. Employers with 20 or more, the group health plan is primary and Medicare is secondary. So the group health plan, if it's a $500,000 claim, the group health plan is going to pay all that, and whatever's left over with deductibles, copays, things that maybe the group health plan didn't cover that Medicare would cover, Medicare will step in and clean up in a secondary position. So that's important. It saves Medicare trillions and trillions of dollars over the almost 40 years that these rules have been in place. And employers who have 20 or more cannot incentivize their older employees, those older high claim, high cost employees. They can incentivize them to drop the group health plan and take Medicare. That's a big no-no. You can't offer them an Amazon gift card to say, hey, why don't you drop our group health plan, pick up Medicare when you turn 65. They take you out in handcuffs for that. And that's a bad one. You don't want to do that. So the test to determine how that 20, what's the calculation? How do you actually calculate these 20 employees is interesting because it's different than the COBRA test. There's no full-time equivalence or anything like that. So again, I feel so badly for small businesses. I used to work in this market, the small and mid-sized market, and it was so frustrating because they're the least equipped to try to track all of these complex formulas and rules. But they follow what's called the 2020 test. And for a group with 20 or more full or part-time employees in 20 full business weeks in the preceding or current calendar year, they become subject to Medicare secondary payer. Their health plan is subject to Medicare secondary payer. It goes into effect immediately, not the first of the following year. It goes right into effect immediately, and it continues through that current year and the following year. Again, very different from COBRA. So that's a summary of how that test works. Well, what if you don't meet the 2020 test? What if you're a small business with fewer? What if you have 19 or fewer employees? Well, if that's the case, then Medicare is primary and the group health plan is secondary. Congress thought it would do small businesses a favor by flipping it around, and it only made it more confusing, as we've just seen. But they thought, okay, well, we'll keep your claims lower, help control, health insurance premiums for small businesses. So they said, well, for small businesses, Medicare will be primary, the group will be secondary. This also applies, interestingly, to COBRA. We'll talk about that at the end under the cautions. But here's the key thing. When Medicare is primary, when Medicare is in the driver's seat paying claims, Medicare coverage is deemed to be adequate alternative coverage. So when Medicare is up front, that is considered adequate alternative coverage. And that has a very significant implication, because these small employers who are exempt from Medicare secondary payer, theirs is Medicare primary payer, as it were, these small employers can elect to terminate Medicare-eligible employees from their group health plan. They can say, at age 65, you're coming off our group health plan. Now, do they do it? Some do, some don't. I think the majority don't do it just because they're not sure what all of the issues are. But that's the first issue. But there's even, to make it, just because it has to be super confusing, we're going to take it another step. And for those employers who choose to let their age 65 plus employees remain on the group plan, the insurance company or the health plan also gets to weigh in. And they say, well, if you're going to allow your Medicare eligible employees to remain on your group health plan, then we get to choose whether or not we want to require those employees mandatorily to take Medicare. And why would they be so mean to do that? Well, their feeling is that Medicare should be paying those claims, not us. Medicare's primary, we're secondary. And if the employee is deferring or declining Medicare, we're going to get stuck with it, and we're going to have to pay the whole thing. So these insurance companies may require that employees take Medicare when they turn 65. And that, when we talk about enrollment, that's one of the issues that you have to contend with. So small employers should always know, number one, are they going to be prepared to drop employees when they turn 65 from their health plan? If they are, they need to do it in a non-discriminatory across-the-board fashion. Can't do it for some and not for others. And, they just have to come off. Or do they want to allow them to remain on the plan? And it would be their choice whether they want to stay or not. If you're going to allow them the choice to stay, then you need to know for sure what is your insurance company's position about mandatory enrollment in Medicare. And you need to confirm that with them. And they can change from year to year. This is a dark little area of health coverage that a lot of brokers are not really up to speed on. You want to make sure that your broker understands this and can give you guidance. If not, then you need to deal directly with the health plan or the insurance company. Maybe you need to get a different broker within that agency, or get a different broker, because you really need to rely on their guidance about all of this. So again, this issue of when Medicare is paying primary, it's deemed to be adequate alternative coverage, and then it opens this Pandora's box of choices that you see here on the screen. Oftentimes, this will then beg the question of, well, if we have our employees come off of the health plan, can we pay their Medicare premiums? And the answer is yes. exempt small employers who Medicare is primary for them. They can pay Medicare-related premiums for its employees if those reimbursements are integrated with the group health plan. It's got to be in writing, got to have a formal plan, but you could pay the Part B premium, the upcharge for a Medicare Advantage plan, the Part D drug plan. You can pay for Medigap supplemental policy if they go on original Medicare. And the details and information about this are found on IRS Notice 2015-17. But that is another issue that comes into play. So again, it makes all of this very complex for small employers, as we have with us today. But having a broker who can guide you through this is really critically important. It's not an area that you want to mess up, trust me. All right, now we're going to talk about Group-to-Medicare Pathways. Group-to-Medicare Pathways. And just a disclaimer, I'm going to assume here when I show you these examples that these groups are larger groups where the Medicare secondary payer is in effect. So group plan is primary, Medicare is secondary. If you're a small employer and you're having your employees come off the plan, or your insurance company requires them, if they stay, to enroll in Medicare, that's going to skew things. So just process everything through that grid. There are two important Medicare sign-up periods for employees. There's what's called the initial enrollment period when they first turn 65. And for those employees who want to defer Medicare, they want to keep their group coverage, they're still working at 65, very common, they can delay or defer their Medicare, and they will subsequently be entitled to a special enrollment period, kind of like a qualifying life event. Medicare calls it a special enrollment period, where they've kept continuous group health coverage. Now they're going to be eligible for a special enrollment onto Medicare once they retire and their group health plan ends. It may be at age 68, it may be at age 78, it may be at age 88. Whenever it is that they finally stop working, the group health plan ends, then they can go on Medicare via a special enrollment period. There are a couple of other enrollment periods, which I'll talk about in the upcoming section after this. But these are the two that really apply to employees and that we want to understand. So I'm going to give you the 4 different pathways. There are only 4 pathways that employees travel to get from the group plan to Medicare. Forgive me, some of these cutouts look a little bit younger than 65, but that was all that Microsoft PowerPoint had for me to work with. So just pretend they're all 65 plus. So here they are. The first one is what I call Medicare all-in, leaving the group health plan, going all in with Medicare. Number 2 is what I call fully loaded, like the term. This gentleman is going to do group plus Medicare. Then we have the classic split. Stay on the group, but only take the free Part A and defer the Part B that you have to pay for. And then lastly is the HSA keeper. This is the person, this is the employee who's enrolled in a high deductible health plan. It's linked to a health savings account, and they want to keep that health savings account open. They want to keep putting money into it. Employer's contribution still going into it. They want to keep it. And in order for them to do that, they have to defer both Part A, the free part, and Part B that they have to pay for. So I'm going to walk you through. Here's our first one. This is the Medicare all-in employee who is basically leaving the group health plan at age 65. For whatever reason, they've decided they're going to come off the group health plan and they're going to enroll when they turn 65 using the initial enrollment period into Parts A and B of Medicare. And that will then launch them into whether they want original or advantage, and there's a couple of other steps which we'll talk about. But that's what they're going to do. They're going to leave the group health plan and use initial enrollment, the initial enrollment period for Parts A and B. Then we have Mr. Fully Loaded. He likes his group health plan. He's going to keep his group health plan, but he's, what the heck? I'm going to get my Medicare too. I'm going to get the free Part A, and I'm also going to get the Part B. I'm going to pay that Part B premium. And if I have a claim, if I'm in the hospital, my group health insurance will be primary. That'll be great. It'll pay for my hospital bill, and it'll coordinate with Medicare, so I'll get more coverage. And if I have a physician charge or an outpatient charge that's under Medicare Part B, my group plan will be primary, and it'll coordinate with Medicare Part B, and I'll get more coverage that way. So I'm going to take everything I can get. I'm going to get Medicare A and B, and I'm going to stay on my group plan. Okay. Then we have and by the way, I need to go back to this. So if if the organization is exempt from Medicare secondary payer, it's one of those small businesses that I was talking about, and that requires the person to come off of the group plan, this option would not be available. You just have to be Medicare all in, because any of these options that require remaining on the group plan wouldn't be available if the employer's choice was to terminate employee coverage at age 65 and require that they go on Medicare, because again, Medicare is adequate alternative coverage. All right, so we talked about Mr. Fully Loaded. Then we have the classic split. And for a long time, this has been, in my experience, was the majority position, where again, this is a person, larger group, they have the ability to stay on the group, or it's a small organization, and the employer's letting them stay on the group. They can take the free Part A, but then the Part B becomes the issue. And so this person says, I don't want to pay for Part B. I've already got my group plan. I don't want to pay $144. That's $1,800 a year. I don't think I'm really going to get that much benefit out of it. So I'll take the free Part A and I'll stay on the group. Now, if they're one of those small businesses and the employer allows them to stay on the group at age 65, you got to check, because the insurance company might require you to take Part B. They say you have to enroll in Medicare, meaning Parts A and B. You wouldn't be able to do this because you'd have to take Part B. So again, that small employer difference that we've been discussing. And then lastly is the HSA saver. This is the person who wants to take or wants to keep their health savings account open. They're covered under a high deductible health plan linked to a health savings account, and they want to keep that open. They want to keep the employer money going into it. They want to keep their own money going into it. And in order to do that, they have to defer all Medicare, Parts A and B. Even if they take the free Part A, the lid is going to close on that health savings account, and no new money can be added to it. They can take money that's already in there, but they can't add new money to it. So in order for this person to keep that HSA alive, they have to defer both A and B, and then they will use that special enrollment period to sign up for both A and B once they finally retire and they come off of the group health plan. All right, so this would not be available, again, if this is a small business and either the employer says you have to come off at 65, or if the insurance company, if they are allowed to remain, if the insurance company says, no, sorry, you have to enroll in Medicare A and B, like with the classic split, this option would not be available in those small business situations. So there you have it. There you have a look at how this all works. And these are the only 4 ways every employee is going to travel. If they're still working at 65, they're going to travel one of these 4 pathways to get from the group plan to Medicare. So let's talk a little bit more about enrollment. The enrollment process is a very important one. And as I said at the outset, you might think it's easy to sign up for Medicare. You'd be very wrong, because it's much more confusing than you might anticipate. So I've already talked about the initial enrollment period, the special enrollment period. I'm going to give you a little bit more detail about those, but there are also 2 other enrollment periods for Medicare. Those 2 at the top there are the ones that I'm mostly focused on, because those really affect employees. But there are 2 other ones, the first of which is called the general enrollment period for Medicare. I call it the amnesty enrollment. And this is for people who, for whatever reason, have not signed up for Medicare. They biffed it. They missed it. They're not on Medicare. They should have been. And every year, July 1st, you can jump on board. But if unless you had continuous group health coverage, which would entitle you a special enrollment period, of course, for these people, they've typically been uninsured, and there would be a delayed enrollment penalty for the Part B premium. And it's kind of a last resort. But there's also this thing that's happening now, which is the annual enrollment period. And this is the one that gets the most attention. It's very prominent. You see it in the advertising all over the place. This is the annual enrollment period that happens each year, October 15th to December 7th. And this is where people who already have Medicare can switch. They can switch their plans. They can go from original to Advantage, or they can switch if they're on a Advantage plan and they want to switch from one plan to another because their doctor's not in the network anymore. They want to change their drug plan. They want to get a new Medigap policy, all that stuff. Anybody on Medicare can do their switching during the annual enrollment period. I put a suggestion in the suggestion box at Medicare suggesting that they turn this to the ASP, the annual switching period, but I have not heard back from them on my suggestion, so suspecting that's not going to happen. I want to talk a little bit more detail about the initial enrollment and the special enrollment. This is when you turn 65. This begins 3 months prior to your birthday month, includes your birthday month, and the 3 months after your birthday month. Important little asterisk there. If you're actually born on the first of the month, then your coverage for Medicare would begin the prior month. So somebody born today on September, what is it? So, October 7th, 1955, I guess it would be. They're turning 65 today. Their Medicare would start October 1st. But somebody born on October 1st, they would actually start September 1st. So just be aware of that little first of the month rule. You can sign up for A and B, or you can just sign up for Part A only. Remember the classic split there. You can just take the free Part A. You don't have to take Part B because you have to pay for it. So Part A is free. You just take that and defer your Part B if you wanted to. The key piece of advice here is don't delay. Sign up at the start of your initial enrollment period. Evaluate all this in the 3 months before any of this begins, before your initial enrollment period starts, so that you know what you're going to do, and then you're locked and loaded, pull the trigger right at the outset of your initial enrollment period. There are currently only 2 ways that you can enroll. Number 1 is online at medicare.gov. In order to do this, you have to have a My Social Security online account. Would strongly urge people to do that, set one of those up, and then they can enroll online very easily. Or by phone. You call the Medicare National Enrollment number at 800-772-1213. Be prepared for a 90-minute or longer wait time. Again, medicare.gov is the easiest way to do it, but you have to have a My Social Security account. All right, big question. Everybody asks, will I be automatically enrolled in Medicare at age 65? And the answer is an emphatic no. Medicare enrollment is not automatic. You have to initiate it. You have to opt into Medicare with one exception, and that is people already receiving Social Security when they turn 65, they will be automatically enrolled in Medicare because remember, Medicare is the health insurance that you get with Social Security. So starting Social Security automatically starts Medicare. If you took your Social Security at age 64, then you will be locked in place and your Medicare will start at age 65. You can refuse the Part B because they can't take the money out of your monthly benefit deposit unless you authorize it, but you cannot refuse the Part A. So just always remember, starting Social Security will start your Medicare. You can do it in the other way around. You can start Medicare and delay Social Security. So you can start Medicare at 65 and say, I'm going to wait till I'm 68 or 70. I'm going to get the delayed retirement credits, those incentives for people to delay their Social Security. But if you start Social Security, you're going to start your Medicare. The special enrollment period, and again, just a quick disclaimer here, if we're talking about small businesses where the insurance company, let's say the employer says, I'm not going to allow you to stay on my group beyond age 65, so that it's not going to apply there. And if the employer allows employees to do that, but the insurance company requires enrollment in Medicare, then the special enrollment period is never going to apply. So just again, I have to keep bringing that small business exception into view here. But this is for employees who have deferred Medicare, whether it's Parts A and B, like the HSA Saver Guy, or whether it's just Part B only, like the classic split, and they have remained covered by the group health plan. They will go through this special enrollment period process, which is a coordinated process between the employee and the employer. So there is work for the employer to do in this process. There is a form that the employee completes. It's called CMS Form 40B, a very simple form that they complete. And then the employer completes the employer verification. It confirms their employment status, also confirms their group health coverage status. Medicare is not going to grant you a special enrollment period just on your word. They need documentation that you do qualify for a special enrollment period. And then the employee is responsible for sending these documents to Social Security. They would send it typically with a cover memo, and they can do it by certified mail to their local field office. Although, and I didn't mention this, because of the pandemic, those field offices are closed to any non-essential visits. Only elevated, high importance people can come in, like to appeal a disability claim or something, but walk-in traffic is no longer allowed at local Social Security offices, and I suspect is not going to be allowed again. So all this filing has to be done either by mail or by fax. There is a temporary online option for people with a My Social Security account, but that at some point is going to go away. So if you want more information about this special enrollment period process, let me know. I do a lot of training, and with every Turning 65 workshop that I do for employees, I also do a train the trainers piece for the HR benefits staff, where I go through how do you actually go through this process. Common questions: do I have to notify Medicare if I defer? No, you do not. There is no notice required. You can just let the train go right past the station, and you don't have to do anything. Some people feel better by sending a letter to their local field office just to be placed in their file saying, hey, I have group health coverage and I'm going to enroll later under a special enrollment period. Just wanted to let you know. I don't believe in giving yourself extra work to do, so I don't recommend that, but some people do. Is there a penalty? I heard down at the senior center, they said if you don't take Medicare at 65, you get a penalty. No, there's no penalty if you maintain continuous group health coverage beginning at age 65. And so you can defer your Medicare, stay on a group health plan if you have that option. Again, all groups 20 plus do. Remember all of our discussion about the small employers. You got to make sure you understand. But for most employees, especially those of larger organizations, they can just stay right on their group health plan. And when they retire, the group health plan ends and they can come on penalty-free to Medicare using a special enrollment period. Once people have an application pending, whether it's an initial enrollment submission or a special enrollment submission, they can track the status of it using a My Social Security account. Are you getting the idea that those My Social Security accounts are kind of important? I hope that's coming through. And there's the website that they can do it. And then finally, all that I've just described with the initial enrollment, the special enrollment process, that gets you Medicare A and B. It does not get you fully completed though, because if you want original Medicare, you still have to purchase a Medigap policy and a standalone drug plan. Or if you want to be on a Medicare Advantage plan, you have to go and select which specific Medicare Advantage plan you want to be enrolled in. So, but you've got to do that A and B process first, and then you complete it by doing the steps that are shown there on that slide. All right, we're almost done. Let's talk about these cautions now with Medicare. The first one is this issue of the Medicare high income surcharge. Technically, it's known as the IRMA, the Income-Related Medicare Adjustment Amount. Some people are affected by this, and if it is, it's kind of a big deal for them. It could be your boss, you're the CEO. You want to make sure you know this stuff. The standard premium, as you see at the top, is 25% of the annual monthly per member per month cost that Medicare establishes each year. But for high income earners, they move into the IRMA, and the percentage goes up the higher their income. It starts at a 35% versus 25%, and it goes all the way to 85% depending on income. And you can see how those numbers play out on that chart. The IRMA status is reset annually, so people can be subject to IRMA 1 year and not the next. I had an elderly couple one time that I worked with that sold a camp on a lake that had a huge capital gain, and all of a sudden in their early 80s, they got hit with the IRMA for 1 year. And like, why have our Medicare premiums gone up so high? 1 year, they got hit with IRMA. It resets each year. It's based on the 2-year prior tax return data. So 2020, they're looking at your 2018 return, and it uses your modified adjusted gross income, known as your MAGI or MAGI. And it's your adjusted gross income from your tax return plus any tax-free interest that you might have received that's not on your tax return. That doesn't include Roth IRA income, but it includes tax-free interest like that you would receive from municipal bonds or government bonds, things of that nature. Now, somebody who has just retired, they're retiring in 2020, and yet their income is being based on what it was in 2018, they can appeal. They can go to an appeal here and they can say, well, I have a work stoppage. And those 8 boxes up at the top, one of them is the work stoppage. The other one is the work reduction, which is kind of part-time, semi-retired. And if you provide income documentation, you file the form, you can be, they will assess an IRMA premium based on your estimate rather than based on your 2-year-ago tax return. One other thing I just need to point out about this is for people who file a joint return, they're married, they file jointly, this includes their spouse's income. So your spouse may be 10 years younger than you and have a very high paying job. That's going to affect your Medicare premium. So it's not just your personal income. If you are married and you file jointly, it will include your spouse's income. COBRA, very, very confusing when it comes to Medicare. And both of our current participants, they're small businesses. They're not affected by COBRA. But for COBRA, if an employee already has COBRA and becomes eligible for Medicare, very frequently now, the COBRA coverage will end once the Medicare begins. So, you know, if you're only 13 months into your COBRA and you go on Medicare, then that's the point at which the COBRA would end. Well, why is that? That's because, remember, Medicare is adequate alternative coverage. It goes all the way back to that Medicare secondary payer stuff that we talked about, small businesses and COBRA. Medicare, when it's in the primary position, which it is for COBRA, it is considered adequate alternative coverage. Now, if an employee has Medicare and they go on COBRA, they terminate and they want to use COBRA instead of buying like a Medigap policy or something of that nature, they could, but it triggers a whole bunch of really weird scenarios. And so I'm not going to get into all the detail of that because we're almost over, but suffice it to say that that's fairly rare when people will do that. The only time I've ever really seen it happen is when people have very high cost prescriptions and they have good drug coverage under their COBRA benefits, their group coverage leading into COBRA, versus what they would be paying out of pocket for a Medicare prescription drug plan. So again, it gets all kooky with COBRA. It's not considered creditable for a Part B special enrollment. So you have to go in under the amnesty. You may pay the Part B delayed enrollment penalty because you didn't enroll at 65 because you're not an active employee. To get a special enrollment period, you have to be an active employee of the business, and with COBRA, you're not. So, and then just to make it super confusing with COBRA, but you would get a special enrollment period for your drug coverage. I have a migraine at this point. I'm going to stop. So anyway, if you have more questions about that, let me know. Health savings accounts have become very popular. And as I've already said, the lid will close on an HSA if you touch any part of Medicare, including the free Part A. You can use the money that's already in there. And as I've said earlier, starting Social Security is going to activate your Medicare. So be aware of that. If you have a high deductible health plan linked to an HSA and you want to keep it going, you're going to have to defer your Social Security. Because you start your Social Security, it's going to start your Medicare, which is going to shut down your HSA. In those situations where people have deferred, the HSA keeper guy there, he's deferred his free Part A. Once he finally takes his Part A, when he retires and he's going to be using a special enrollment period, just because it's Medicare, it's going to be confusing. Part A is going to begin 6 months retroactive. And there's a reason for that, which we don't have time for right now. But that becomes the date. That 6-month retroactive date is the end date for the HSA contributions. You'll actually have a split. Part A will be 6 months earlier than your Part B. And it's that earlier Part A date that is the end date for the HSA contributions. Make sure you have some sort of best practices here, or you communicate with people in your organization who are going to become eligible for Medicare. Just say, hey, there's some stuff that could happen in your HSA. Make sure you understand, and sending annual reminders would also be good. If you'd like some of this information, I can let you know. And again, just to go back to this, if you have a small organization and you're going to allow employees to stay on the group, which you don't have to, but if you allow them to stay on the group, but your insurance company requires that they take Medicare, that's shutting down the HSA. They're not going to be able to continue an HSA. They're just not going to be able to do it. Use the money that's still in there, but the insurance company's taking away that choice by requiring that they enroll in Medicare. Did you know that Medicare will not cover you when you travel outside the United States? It does not. And some Medigap policies will cover up to $50,000. They'll cover 80% up to $50,000. Others do not. And then some limited coverage through Medicare Advantage plans. It's going to vary depending on the plan. By the way, I don't expect anybody on a cruise ship this month, but you never know. You just really have to be careful if you're traveling abroad with Medicare. I recommend, if you have concerns in this area, that you Google search short-term travel health insurance. There are policies out there that run from 2 weeks to 2 years for Americans traveling abroad. And in the many decades that I was a broker, I worked with several situations where people were traveling abroad and had serious, in some cases, life-threatening health emergencies. And you get into all kinds of crazy insurance issues there. So you need to know what your coverage is, and with Medicare in particular, the limitations of that coverage. And then lastly, there's this issue of long-term care. Medicare is very limited. It only pays 100 days in a skilled nursing facility. And that has to be directly coming out of a hospital stay of at least 3 nights where you're recovering, you're showing improvement, you have a plan of care. They would cover up to 100 days, some pretty sizable co-pays in there. But that's it, a little over 3 months. So Alzheimer's, dementia, frailty, whatever it is, all the many reasons that people go into nursing homes would not be covered by Medicare. There's a home care benefit that also would be available through Medicare, but it's limited. It does have limits, and there would be no coverage in any case for assisted living. So if this is an area of concern, I strongly recommend that you visit longtermcare.gov. There's lots of good information about community resources, about legal planning to address this issue, as well as private insurance options, which are available. So you can get a lot of good information there, and then perhaps connect with a local elder law attorney or financial advisor who works with long-term care insurance, asset management surrounding this area. If you want more information about what we've talked about today, here are some good sources, some good resources that I strongly recommend. And you can call the Medicare helpline if you're calling on behalf of an employee. Typically, it's for employees or who are approaching Medicare age, or people already on Medicare. But if you call as an HR person and you can say, hey, I'm just trying to help an employee here, I have a question, you will usually get an answer. And I've never waited more than 10 minutes calling the Medicare helpline. Here's the Turning 65 workshop. It is now virtual. It's done online. This gentleman is watching it on his TV screen there. You can't see that, but he is, trust me, and he's enjoying it immensely. And you can, in the back of your handouts, you'll see information about this. And as I mentioned, one of the things that really makes this great, it's an independent learning program. I was talking to Claudia earlier. This is not a sales pitch. I'm not there to sell stuff. I get paid to do this training. So it's completely independent, it's unbiased, and with every session, there's a training session for HR and benefits people on this group to Medicare transition, which is a really high stakes critical area. But this is a 90-minute program divided into Social Security and Medicare. Employees can access it on their own personal time for up to 30 days, and I think it's great, and a lot of people do too. I also do, in addition to that training that comes with each Turning 65 workshop. I do direct training. I do webinars now for HR and benefits professionals on a variety of topics. And if you'd like more information about that, just let me know. I can put you on my mailing list, and you can get that information, or you can connect with me on LinkedIn and stay in touch that way. In your handouts, in those pages, you will find a section with common questions, common employee questions, which help answer a lot of the questions that employees will often have, some of the more common ones. And I would call your attention to that section of the handouts for some additional information. All right, I am done. Whew. I'm going to stop sharing, and I'm going to come back. Hey, you're all still there. Sometimes I come back and everybody's left. I couldn't take that. That was too painful to listen to. But you're still with us. Any questions that you guys have? And if you do have questions, be sure to unmute. And maybe I guess I'm the administrator now, don't I? I'm going to have to. Okay, Jennifer, you've unmuted. So you guys have all unmuted. Go ahead, Jennifer.
Okay, so looking ahead to employees that will be turning 65, and we are on the small employer side. So I don't think our health insurance would keep them on the plan. And it is an employee benefit to have us cover that. So then the value of what they're going to get with us covering the Medicare and a supplement is way less than that they would have gotten as a benefit as an employee. I was thinking the HSA was an alternative, but now I see that's not an alternative.
Yeah, it's tough. And so the first thing with that, number one, is make sure you're communicating with your broker or with the health plan, and you get this information in writing. Don't do it over the phone, get it in an email, and say, can you clarify what our status is regarding Medicare secondary payor, because we have an employee who will be turning 65 and we need to know. And they may have to do some research. It varies widely. Some brokers don't have a clue. Other brokers understand this fairly well, but you need to really get that in writing, because you're going to rely on their guidance for this process. So the first issue will be, if, assuming that you are legitimately under, you're exempt, you're under 20, and your Medicare will be primary for your employees. As the employer, you can say, hey, you're turning 65, your group coverage ends, you've now got Medicare, which is an adequate alternative coverage option, and we will pay your Medicare premiums. You can do that. Or you could say, well, no, you can stay on our group plan. It's your choice. We're not going to pay your premium. You can choose to go on Medicare if you want to, or you can stay on our group plan. If you are going to go that route, then you need to confirm with the insurance company what's their stance. And are they going to step in and mandate that those employees take Medicare? That's the critical thing, because you don't want to give employees that choice. Hey, if you want to, you can stay on the group health plan when you turn 65, only to then discover that the insurance company was going to mandate that they take Medicare. And that happens with the HSAs. You'll have an employee who'll say, oh, I love my HSA. You guys are putting $1,000 a year into it. I want to keep my HSA. I'm going to defer Medicare. They have a heart attack. And the insurance company at that point says, oh, wait a minute. That employee was supposed to be on Medicare. Medicare would have paid the bulk of that claim. So that's now a phantom expense. The employee's responsible for that because they were supposed to take Medicare. That's been a big issue. A lot of state insurance departments are really cracking down on health plans and insurance companies, saying you need to clearly communicate what your practice is in this area. I've seen companies change it. A couple of years ago they were doing it. Now they're not, So you really need to pin that down and get that in writing. Again, your broker should be the one who you're working with. This is where brokers earn their commissions, when they work with you in this area, because it's so high stakes. If they screw it up, the consequences can be catastrophic. So you need to, again, there's those two choices. As an employer, do you want to require them to go off? And if you do, then you can pay their Medicare premiums. The cautionary part there is drug coverage, because they're going to potentially, if they have high expense prescription drugs, They could be subject to a lot more out of pocket with Medicare drug coverage. But if you are going to allow them to remain on your group health plan and allow them to choose whether they want Medicare or the group, then you have to confirm with the insurance company what is their requirement for those employees. And the crazy thing is, Jennifer, some will do it, some don't. It's nuts. It shouldn't be that way, but company A might require it, company B doesn't, and they can change from year to year. So you got to get that pinned down in writing. And now think of how many small business owners don't know this stuff. And they're just skating along and boom, they have a crisis. Yeah. Ellen.
Well, that was our crisis last fall, as we had a husband of an employee turn 65, and then an employee turned 65, and the insurance company wouldn't cover them.
Yeah.
Said they had to go onto Medicare.
Right.
And then there was the whole discussion about, well, how do we cover the Medicare? But as it turned out, the Medicare expenses that the employee was paying was equal to their portion of what they would have paid for health insurance if they were on the plan. So they just went off the plan and paid their own Medicare expenses. But I'm curious.
It doesn't always work out that way too. And again, those drug coverage situations that I mentioned are the big variable. Yeah. Yeah.
Well, I understand a lot more today after your session than I did. And I didn't understand the drug insurance. And so I guess you made some statement about the employer can pay Medicare related premiums as long as it's integrated with the group health plan. And what does that mean exactly?
So there's a kind of a legal definition to that, but shorthand is it has to be a plan in writing. And you say, this is what we do. And so it's established. If you look at IRS notice 2015-17, and you can even Google search some of the commentaries and summaries, you'll find that. But basically you have to have something that's in writing that outlines what you're going to do for these employees as far as their Medicare premiums go. And again, you can talk to your broker. Your broker should be able to help you with that, but don't do it on an ad hoc, we did it for one, we're not going to do it for this one, all that kind of stuff. You have to have some sort of formal plan that is integrated, as it were, with your group health benefits. So it's not just an informal thing.
So you're saying it's a plan that we as a company, our policy, it would be a company policy, not necessarily something that the health insurance
correct
folks have written up.
Correct. Yes. Yep.
Okay. And then in terms of the costs of what the employee is paying, we can get that information based on that spreadsheet that you showed, the 144.60.
Yes. So that's a wild card. That's another wild card in all of this, because you may have people who they finally get the idea, okay, Medicare's not free, I have to pay for it, but it's only $144 a month. And it turns out they're actually subject to that IRMA high income surcharge, and their coverage is a lot more. And if this is the CEO or the principal or whoever, they're going to be a little bit not happy when that first invoice comes from Medicare and it's through the roof. So you want to make sure if someone is going to be subject, and if they're married and they file a joint tax return, it's going to include their spouse's income, and their spouse is a corporate attorney making $400,000 a year. That's going to affect their Medicare premium in a big way. Mm-hmm. So you have to be on top of that as well. Or they have to be on top of it. You're not their accountant, but you want to at least alert them to that issue.
And what about the Medigap plans? How do you find out about those costs?
Best, again, an insurance broker who works in that area is good. Massachusetts is actually great. Massachusetts, you don't have to, other states can be much more involved. You have to there's a lot more. There's underwriting. There's all kinds of stuff you have to go through. But Massachusetts actually works really well. And there's really only a couple of options. And you can get that by Google searching. Just go to Massachusetts Medigap Guide and ignore the first several ads that are going to pop up, and go right to the PDF that's put out by the Massachusetts Department of Insurance. And you can find a lot of information right there.
I guess one of the things I want to try and accomplish is to say, you know, here's the group plan for everyone who's under 65. They're eligible for that, and we pay 75% of those costs. And then anyone over 65, here is what Medicare and Medigap and Part B and D cover, and how do you make it equitable, I guess?
Well, so that's going to be the thing. And I think what you ought to do is avoid trying to steer them to any particular arrangement, and simply say, you know, get a turning 65 workshop going, and come in and I'll tell them all about, you know, Social Security, Medicare. But that idea of you can choose original or Advantage. If you do original, you're also going to need to get a Medigap policy. I think because most people are so ill-informed about all this stuff that I've been covering, it becomes difficult for them. And what you would simply say is, we pay currently 75% of the premium for our under 65 employees, and we're going to pay 75% of your Medicare premium, or we're going to pay $500 a month, or, you know, whatever it is. Rather than trying to say, you know, we'll get you a Medigap policy. Well, what if they want what if they want Medicare Advantage? You know, they're going to make those coverage selections themselves, and you're simply going to provide the funding for it through that mechanism.
Okay. And can all of that come out pre-tax?
It can. There are certain criteria that have to be met, though. Yeah, that's a whole, I don't include that, but there's a whole criteria that has to be. You want to talk with do you use a third-party administrator for your pre-tax?
Yeah, we have an accountant, and we also have a payroll company.
Yeah, they'll guide you in that, in terms of because you got to make sure you've got certain elements of that are correctly set up in order to do it. Yeah.
Okay.
Yeah. Good question. You guys are so far ahead, so far ahead. Claudia, I hope you can get a lot of the members to watch the archived version of this. You know, maybe Jennifer and Ilan can do a testimonial or something, because this stuff is crazy for small businesses, and problems happen every day. And you guys now have, you know, a level of understanding about it that goes way beyond what most small business organizations have. So,
right. This is truly informative, and there's a lot of homework that businesses can do to prepare, but they don't even know that they need to do this. So
they don't know what they don't know.
They don't know what they don't know. And I love the lesson about the Social Security online. I just found mine online and started building that, and realized, you know, but when you said that, I thought, oh, ding, ding, another reason to have.
It's really true. It makes it so much easier, but so many people, you know, they wait till the last minute, number one. So they're going to try to sign up for this stuff a week before their 65th birthday. Well, there's going to be a delay. So their Part B is going to get delayed. And, you know, if they're coming off the group, then they've got a gap in coverage. And I didn't even mention, I don't think I did, if you go back and listen to the archive version, for the special enrollment period where the employee's going to delay Medicare, stay on the group health plan, and when they retire, they're going to go on Medicare.
Yeah.
For that coordinated process, there's a part of it that HR or the employer does to verify their employment and their group coverage. That process should be done about 2 months in advance. And I didn't mention that, so my apologies. But don't wait till they've given their 2-week notice or something, or they retired last week and the group health coverage is going to end. You want to do all of this stuff as far in advance as possible. And that hinges on understanding what decisions you need to make, and which many people don't. So.
Well, Thomas, this was incredibly illuminating. Thank you so much. So important for our businesses to know. Thank you, Jennifer and Ilan, Hitchcock Center, and Keen Riddle Architects for joining us.
Yeah,
Awesome.
thank you so much.
Thank you.
Thank you,
Bye-bye.
guys.
Bye-bye.
Bye-bye.